Hindi yun yung gusto nilang sagot. Alam mo yan, after na interview, iniisip ko, ano ba, pumasa ba ako? Tama ba yung mga pinagsasagot ko? What's up you guys? Welcome back to my channel. Oh, kung bago ka sa channel ko, you are very much welcome to the family, and please don't forget to subscribe, and of course, press mo na yung notification bell para updated ka sa lahat ng mga bagong uploads. Kung di mo pa ako kilala, my name is Raymond and I'm your Pinoy nurse here in Ireland. Guys, I have a lot of videos for you, especially sa mga nurses na gusto magtrabaho dito sa Ireland, and I hope na makatulong talaga sa inyo yun. And please, road to 500 subscribers muna tayo guys. I know medyo mabagal yung pag-grow natin, but I can see sa mga views and all that, actually a lot of nurses are appreciating all the videos, and maraming salamat. Okay guys, so this is another info vlog for all of you guys, and this is all about the Skype interview. I will give you some tips and also my preparation, and of course kung ano ba yung mga tinanong sa akin during the Skype interview. Backstory muna tayo guys. So as you all know guys, yung agency ko dito sa Ireland is Kate Cowhig Recruitment, KCR. Okay? And sila yung nag-book sa akin ng Skype interview sa isa sa mga hospitals dito sa Ireland. I received actually their notification after 3 days nung nag-apply ako. They called me and informed me that I am shortlisted for Skype interview. Yes guys, Skype yung application na ginamit namin. I just don't know now kung may ibang application na ginagamit, especially nowadays na yung Zoom is very popular, or maybe yung Google Drive video call or FB Messenger. I don't know guys, but in my case guys, it was Skype interview. Ano yung mga preparations na ginawa ko before the Skype interview? Preparation number 1, you have to make sure guys that you were off on that day of the interview. Kailangan wala kang distractions guys, or you are not from night duty. It is much advisable and much better actually na kailangan off ka sa day ng Skype interview mo. If you need to exchange with somebody else, just do it. Okay? Kung off ka naman talaga, well, that's good. Number 2 guys, internet connection is very important guys. You have to make sure na yung Wi-Fi signal nyo or yung data connection is really good. And you know what, kasi sa isang bahay, di ba, kapag may Wi-Fi ka or your data connection, there's certain spot in your home that has a very good reception signal, di ba? So you have to make sure that you know where it is. Ang ginawa sa akin agency, we had a test drive para dun sa connection before the interview. So it's really good. And I hope ganun din yung gawin sa inyo ng agency. Third guys, you have to really dress appropriately. Just imagine guys, this is a job interview. Yun nga lang virtual kasi Skype diba? So, but still, you know what, first impression really matters guys. So you really have to make a statement right away that you are serious about this job and you really wanted to have the job. So ang ginawa ko, I wore a long sleeve and then naka-shorts lang ako actually. Kasi yung upper body mo lang naman really matters and hindi ka naman tatayo or what. For the ladies there, if you need to wear makeup, just do so, okay? And make sure yung lighting is very good. So ang ginawa ko that time, kasi hindi pa naman uso yung ring light in 2018. Well, wala lang ako noon. Naka-face na ako sa window. Chinek ko din sa computer ko, yung kita ba yung mukha ko. So kailangan presentable ka talaga and kitang-kita ka. So if you have the ring light, well, that's good. You can actually turn that on para lang mas maganda yung lighting. And just make sure yung background nyo is really good, na walang masyadong clutters or whatnot. You should appear very professional. Number 4 guys, do not be late during the Skype interview. Mas okay na ikaw yung mag-intay kaysa sila yung pinag-iintay mo. I would advise that you have to be ready 10 minutes before the interview. So parang ready ka na. Diba? Kasi yun naman mag-cram ka dahil super late ka. Number 5 guys, you have to know your employer. Ito sa lahat ng mga job interviews ko, even before yung first job ko sa call center. This will really make a very good impression, especially sa interviewer mo. Ibig sabihin, you are really into that company. You are really eager to have that job. Kaya kailangan alamin mo. So ang ginawa ko, I just checked the website of the hospital. And then yung ano lang naman, yung history lang kung paano nagsimula. And you know what? They really ask. Just a brief history guys. And you know, just to tell them that you know something about your employer. Number 6 guys, you have to know who's your interviewers. In my case guys, I was informed by my agency that there will be a clinical nurse manager and human resources specialist. In that way guys, you know what to expect, especially kung ano yung mga tanong na ibabato nila sa'yo. Kasi alam mo kung sino yung mag-interview. And also guys, you have to know their names as well so that you can address them properly. Kasi dito sa Ireland guys, first name basis talaga. Hindi uso yung mga ma'am and sir dito, hindi talaga. If you will call them ma'am and sir, they will actually ask you, just call me on my first name. Number 7 guys, you have to prepare for the question and answers. Sa agency guys, I don't know sa ibang agency, but sa Kate County guys, they will give you a certain questionnaire. Maybe ito yung mga questions na tinanong ng mga previous employers to their applicants. Kaya siguro na-note na nila and then they just put it in black and white. So they gave me that questionnaire and I just made sure that I read it kasi napaka-importante na medyo handa ka sa mga itatanong nila. Mga sample questions lang naman yon. So not necessarily yun ang itatanong nila sa'yo. Siyempre may mga spontaneous questions sila na kailangan mo din paghanda. Number 8 guys, you have to really focus guys, especially sa accent nila guys. And you know what, to tell you frankly guys, a British accent is really different to the Irish accent. And ang Irish accents guys, iba-iba din. So depende kung saan lugar ka sa Ireland, you will hear a different accent. So you just need to focus guys. Parang siyang listening task ng IELTS guys. So you really have to be very keen sa mga nadidinig mo. And I would suggest guys that you use a headset. In that way, mas madidinig mo sila ng mas maigi. And of course, they will hear you clearly as well when you say something. Kasi malapit sa yung mic. So yun guys, ano ba yung mga tinanong ng interviewer sa akin? So mostly guys, ang mga tanong ay nanggaling sa Clinical Nurse Manager 3. So Clinical Nurse Manager 3, yun yung pinakamataas. Siya yung pinaka-head actually ng ICU and then high dependency. Make sure that you know what is written in your curriculum vitae. Believe me guys, binabasa nila yung curriculum vitae mo. So yung mga details na nilagay mo doon, usually i-ask din nila sa'yo just to verify. Huwag kayong magdadagdag or magbabawas. Kung ano lang talaga yung experiences nyo, yung mga cases na na-handle nyo, just tell it to them. That's it. Plain and simple. And regarding your employment history guys, you just need to give them the overview. For example, the hospital, kung saan kang country na nakapagtrabaho na, and also your years of experiences, etc. Basically, the moment you entered the clinical area, alam mo yun, how you receive your allocations, may mga kailangan ka bang i-check after receiving the allocation and whatnot. So I just explained it to them kung ano yung usual routine sa unit. I just told them that in Saudi Arabia, we are receiving our patients based on the allocation of the charge nurse, and then may extra allocation pa kami like checking the crash cart, medications, etc. And then afterwards, taking the report from the outgoing shift, verify the orders, and of course confirm kung ano yung mga na-endorse sa'yo, and then bedside care, medication management and administration, and doctor's rounds, turning, etc. Yung mga ganung bagay guys. And of course, prepare the patient for your endorsement, anything to be carried out, to be followed up, yung mga ganung bagay. Maybe they're just asking if you really know what your job is, and if you were really into it, if you were systematic or organized sa mga nursing task natin. I applied for high dependency unit, pero I've been working as an ICU nurse for like 8 years now. Tatanungin nila, so ano ba yung mga normal cases na na-handle mo? Kailangan sabihin mo lang kung ano yung mga usual talaga at medyo gamay na gamay mo na. So I just mentioned to them about cases of community-acquired pneumonia, ventilated patients, sometimes with cases of H1N1, yung mga ganang bagay. Kasi yun yung usual kung na-handle sa ICU. Tell them actually something that is special to your area na mapapabilib sila somehow. Kung ano lang yung kaya nyong explain, kung ano lang yung kaya nyong sagutin, yun lang. Just make sure guys that you know what you're talking about. Huwag na tayong magdagdag or bawas pa sa mga cases na na-handle natin or whatnot. Kasi what matters to them is how you manage your patients, how you manage your nursing task, and all that. What I discussed was tracheostomy care. Kasi mostly may mga trachea patients kami sa ICU. So I just explained to them about yung tracheostomy care, about the VAP bundle, how you prevent it, yung mga PPI, yung mga oral hygiene, etc. You just need to be very comfortable about discussing those stuff. So specifically, they asked me about medication management. What if your patient received a wrong dose of medication? Ang natatandaan ko yung antibiotic na minention was gentamicin. So sinabi ko na lang that I would refer the case to the doctor, and if needed, like to check the gentamicin level, and of course check any reaction from the patient or whatnot, the vital signs, etc. Now the tricky question was, are you going to tell to the patient what happened? Pag tinanong kayo nun guys, what will you answer? Sige nga, comment down below. Ang sinabi ko guys, I am not in the position to tell it to the patients. So hindi yun yung gusto nilang sagot. So they just explained to me guys na sa Ireland kasi it is very important yung communication sa patient, that yes, you will admit to the patient that something happened, but don't worry, we are sorting everything out. We are going to check your antibiotic level in your blood, and the doctor is aware about this, and we apologize. Itong tanong na to guys, medyo popular to sa lahat ng field, you know, kung ano man nature ng trabaho ng isang tao. Lagi itong tinatanong, I believe. So sinabi ko na lang na communication is very important, and if you have a conflict with your coworker, it is better to fix it on your level. If not, it can be escalated to your manager, if not to a higher position. Dito naman guys, ang gusto nilang tanungin kung updated ka ba sa mga trainings and seminars mo. I just told them that yes, I just recently had my ACLS. I also had the seminars of this and that, yung mga ganon. So ibig lang sabihin guys na we are not stopping. Like nursing is not the end point. It's really important to better yourself by attending the trainings, seminars, etc. So sa akin guys, ito yung parang deal breaker mo eh, di ba? Syempre hindi mo nasasabihin sa kanila na I can see myself working in another area or another institution. Kasi syempre, you're applying for a certain position or post sa isang hospital. So, they are expecting that you're gonna stay with them longer. So, sinabi ko na lang, I can see myself well adjusted with the routine and hopefully be a preceptor, and if given a chance to have some master's degree, etc. So, dito guys, I just said, I'm okay. Siguro tatanungin niyo ako, bakit hindi mo tanungin yung sweldo mo? Because I know that dito sa Ireland, especially if you were working in HSC, yung mga government hospitals, your salary will be based on the salary grade. So I was thinking, hindi siya appropriate to ask. Yun lang, parang wala na rin ako matanong sa kanila kasi parang ang tagal-tagal kong nagsalita all throughout the interview. So wala na akong maisip kasi syempre may kaba ka na rin, may alam mo yun, yung lahat na ng anxiety mo nandun na. So parang wala na akong matanong. After the interview guys, yung agent ng Kate Cow, he talked to me and informed me that they would just call me or communicate with me after a few days. Alam mo yun, after na interview, iniisip ko, ano ba, pumasa ba ako? Tama ba yung mga pinagsasagot ko? Yung mga gana. And fortunately guys, after 3 days, I received an email from Kate Cow that I got hired. So I hope guys na may mga natutunan naman kayo sa diniscuss ko today. And by the way, if you already had this kind of experience in Skype interview, please comment down below naman para at least malaman din ng mga ibang viewers natin about your experience, di ba? Parang batuhan lang tayo ng comments guys. If you like this video, please don't forget to share it with your friends, and please don't forget to subscribe to my channel, and follow mo na rin ako sa Facebook page ko, Nurse Raymond 123. Okay, I think that's it for now. So, kita na lang tayo sa next video.